Now we will be going over the nasal and oral cavities of the head. To begin, this is the nasal cavity here. Here's the opening of the nose. As air comes in, it's going to be filtered by 3 different nasal concha. Shown here is the superior nasal concha, the middle nasal concha, and the inferior nasal concha. As you move to the back of the nasal cavity, you're going to move into the nasopharynx, which is where the nasal cavity joins with the pharynx. It's going to be this region right here. Next, moving to the oral cavity, just for orientation, here and here are the lips. So this is the opening of the mouth and then into the mouth. If you push your tongue up to the top of your mouth, you're going to feel a hard surface. That's called the hard palate, shown here. The hard palate is made up of 2 separate bones. The more anterior portion here is going to be the maxilla bone, and the more posterior portion, shown here, is going to be the palatine bone. The hard palate continues on into the soft palate. The end of the soft palate is called the uvula. When you look at your throat in the mirror, the hanging down structure is the uvula. Beyond the uvula, shown here, is going to be the palatine tonsils. The tongue muscle itself, the big belly, is going to be genioglossus. Down below that, shown here, is going to be mylohyoid, and then these fibers running in this direction is going to be geniohyoid. Those 2 muscles are going to the hyoid bone, which is shown here. Shown as this light blue color, here is going to be the epiglottis, which is going to function to cover up the trachea when food is coming, so that food only goes down the esophagus. Next to the epiglottis, shown here, is going to be the thyroid cartilage. And shown here is going to be the cricoid cartilage. Next, we are going to have our true and false vocal cords. The false vocal cords occur here. They're also called the vestibular folds. Down below the slit is going to be the true vocal cords, which is what you use to speak. And these are called the ventricular folds. Ventricular folds, vestibular folds.